Monroe County, New York has the lowest rate of COVID-19 infections for communities over 500,000 people in the United States. This shows that our actions and the work that all of us have been doing across Monroe County and our collective efforts have been working. And because of our continued collective efforts, it is so important for our ongoing success that as we enter into the fall and winter months, Dr. Mendoza and I thought it would be valuable to have weekly briefings with you all and the public so that we can ensure as we move into these winter months that information that the public needs to have in order to keep that progress that we've been making continues, and that we allow our community to stay safe and healthy while maintaining our ability to continue the steps of reopening the economy and keeping our schools open as well for children and families. So let's talk about a little bit about where we are today. While our infection rate has remained low, we have continued to stay vigilant about helping people and businesses in need throughout the difficult times, thanks in large part to the $129 million in federal CARES Act funding secured by Congressman Joe Morelli, Senators Chuck Schumer, and Senator Kirsten Gillibrand for Monroe County. And we want to thank our partners in the federal government for supplying those resources to Monroe County. Because of their help, Monroe County has been able to commit $6 million to the Eviction and Foreclosure Prevention Pilot Initiative. This program is critical, and we need to get this information out to folks who are struggling. This program will provide direct assistance to people and families who are in need of up to 5 months of back rent or mortgage payments. This is an ongoing program that will be available through the end of this year. Anyone who in need can begin this process by calling 211. So again, this is a program that was made possible because of the CARES Act funding. It can help people who are facing eviction or foreclosure be able to stay in their homes, and particularly as a result of the COVID-19 pandemic. So if you are in that position and need help, all you have to do is call 211 because of this first of its kind collaboration and pilot program that we've set up. It has really never been easier to try to access these services. So we'd encourage folks to call 211. We've also expanded our commitment to improving COVID-19 testing to underserved communities by partnering with New York State and the city of Rochester, and of course, Dr. Mendoza and his team and other community partners to host free testing drive-throughs, free testing at area churches. This initiative has been incredibly well received throughout, particularly the city of Rochester, and will continue today, tomorrow, and Saturday at the House of Prayer and Restoration on Hudson Avenue from noon until 7. So again, we'll be offering free COVID-19 testing at the today, tomorrow, and Saturday at the House of Prayer and Restoration on Hudson Avenue from noon until 7 p.m. We have also continued our efforts to provide various items of PPE, face coverings, face shields, gloves, and hand sanitizers to barbershops, hair salons, and restaurants to enable them to reopen their doors quickly once they were given the green light. We've helped protect the youngest among us by ensuring our schools were able to reopening by distributing over 3 million face masks, nearly 1,000 touchless thermometers, and thousands of gallons of hand sanitizer across Monroe County. We've also given roughly 100,000 pieces of PPE to child care providers so that parents can feel safe sending their children to daycare and so that they can return to work. Beyond PPE and at the county level, we've also developed a variety of initiatives to help our community deal with this new normal, including the zero interest small business loan program, the coordination again of distribution of free face coverings, the new employment portal to help local long-term care facilities recruit new staff. And we've also launched a new health screening website, which is still active, and we're still encouraging residents to sign up for rockcovid.org. Rockcovid.org is an important tool for healthcare professionals like Dr. Mendoza and our hospital systems to be able to track symptoms as they develop throughout our community. And then just 2 weeks ago, I was joined by MCC officials to announce the launch of Empower Healthcare, which is a CNA to LPN workforce development program that will be aided by $550,000 in CARES Act funding. This hands-on program will help mold our next generation of healthcare workers and essential employees, which are needed now more than ever before. Monroe County residents have remained resilient and embraced our role in helping to stop the spread of COVID-19. And this has led the Finger Lakes region to be among the first in the state that had started the phase-in reopening approach. And while these collective efforts have helped our region avoid dreaded spikes in the COVID-19 cases, we're by no means out of the woods yet. We have seen spikes in cases and in communities across New York, in different areas, and also across the country. So we must continue to practice safe social distancing, masking, and all the other guidelines that we've put in place to continue us on this path to success, so that we can continue in the path that we're heading down into. So I just encourage the community as we go forward, particularly into the fall, into the winter months, to remain vigilant, to not give up on the protocols that we've had in place that have gotten us to this point, which I think have been very successful given our status as having the lowest spread infection rate in the country, according to the latest reports. And so if the community has questions, also as spoke about PPE earlier, particularly our new program with child care centers, PPE can still be accessed by emailing us at covid19@monroecounty.gov. Again, that's it's an email address, covid19@monroecounty.gov to request additional items of PPE. So with that, I'll turn it over to our Public Health Commissioner, Dr. Mendoza, who can provide us a health update.
Thank you, County Executive Bello, and thank you to all of our colleagues in the media for joining us for what I hope will be a series of productive times together. There hasn't been a week that's gone by in the last 7 months when there hasn't been something to update you all on, and so our hope is that we can provide constant, consistent updates to you all so that you can do your important job of informing the public about all of the developments that are related to COVID-19. As the county executive mentioned, we are now in the 7th month, and depending on who you ask, it's only been 7 months or it's been a long 7 months. The reality is that we've come a long way and we have a long way to go. The county executive shared with you the glimmer of hope, the good news that we are doing very well. In fact, as you look at all of these counties across the state, or across the country, we are doing among the best. That report does in fact report that we are at the top. And I want to stay there. And the way we stay there is by keeping our vigilance, remaining patient with what we can all agree is a very, very difficult time. So I want to take this opportunity to thank my colleagues in the health department, most importantly, who have been working 24/7 for these last 10 months on the issue of COVID-19. I also want to thank all of you in the community, because we could not get here were it not for your understanding, for your patience, for your willingness to follow the facts, to follow the guidance, to follow the evidence, and to pivot. Because we know that a lot of this guidance has changed multiple times since the beginning of this pandemic, and I guarantee you it will continue to change. And so we need to continue to follow the science and to continue to follow the data. So with that, I want to show you a quick slide of where we are now. I think the question I get most often is, what comes next? So I'm showing to you here, hopefully if you see it, a graph of the daily reported cases in Monroe County dating back to August 1st. The blue line there shows the actual number that we report on a daily basis. And that red line shows a 7-day rolling average to kind of flatten out all the spikes and valleys. So as you can see, overall, we're not that different from where we are in August 1st. And I want to put that perspective out there because there's a perception that things are going up. It is true, in fact, that things have gone up slightly since the beginning of September. So if you look at the last few, bottom third of that graph there, the numbers have gone up. The context I want to put around that, particularly around the last week when you've seen numbers in the 50s and 60s, and I believe today it will be 52, we are actually testing more. So as you look at the total number of cases, also make sure that you're looking at the total number of tests being performed. We are performing a lot more tests now because we're identifying a lot more large clusters. And with all of these clusters, the average number of contacts per case has gone up dramatically since the beginning of September, which is not surprising given that people are gathering more, schools have reopened, and all of the activities, or many of the activities that are associated with school, have begun to reopen in some fashion as well. So I want to make sure that you're understanding what we're looking at here. The total test number has gone up, and because of that, the number of positive cases has gone up, and that's largely due to the work of contact tracing and identifying all of the individuals who have been in contact with these positive cases. There have been a number of trends that we've seen. Larger gatherings have been very risky. You know, we're seeing this particularly outdoors, and my concern is as we go indoors, will the same pattern continue? Something else that we've noticed is the role of carpools. For example, we had a very large cluster that we're still investigating now that we had thought might have been related to a workplace, a business place, but it turned out that it wasn't the business at all that was the reason for the spread. The link was actually that many of these people in this community were carpooling. And when we'd look in that business, for example, and we'd find all the people who were positive, they were all people who were carpooling together. And so I want to put out a specific call to be thoughtful about how you carpool. Carpooling makes very good sense from an environmental perspective, but it does put one at risk, greater risk in the sense from a COVID perspective. So with that, I will stop sharing my screen here and hand it over to Julie Phillip to begin questions.
Okay, thanks, Mike. We're going to start with Tanner Jubinville from 13 WHAM.
Good afternoon. First question I have, been looking at a nursing home in Corning recently. They had a rash of cases and deaths since September. Wanted to know, are you keeping that type of data on your radar, and how might you be working with nursing homes up here to prevent a second wave through those facilities, so to speak?
Certainly, I believe that's in Steuben County, if I'm not mistaken. We have been following that. The Steuben County numbers have gone up dramatically, or what looks like dramatically, given the size of the population in Steuben County. And so we have been continuing here in Monroe County. The largest liability in nursing homes is actually the staff. Now that staff, we know that the staff were the reason for the introduction of infection into the nursing homes earlier. We've been very careful to make sure that we're testing all staff at least once a week. I understand the challenges around limiting visitors to the nursing homes. That's in place because there is a sizable risk, and we want to make sure that we keep our nursing home residents safe. So we are following all of those guidelines, being very vigilant to try to do everything we can to prevent the reintroduction of infections into our nursing homes. But so far, so good. We haven't seen anything of the sort here in Monroe County yet.
And a follow-up, Tanner? You
mentioned earlier about some gatherings possibly leading to some increases in cases, and I saw this CDC's recent kind of reporting about the worry about Thanksgiving gatherings and that. Do you have any concerns about upcoming holiday gatherings? And I mean, what should people do to be safer?
I'm glad you mentioned that, Tanner. We are actually working on guidance here in the health department that we hope to issue in early November that describes just that. How can we look at travel in the coming Thanksgiving and winter holidays and find ways to do so safely? I think we can all agree that we are all yearning to be with one another, particularly with our close family who may or may not live in the area. And, I think the reality is it's important for us to reconnect, and what we want to make sure we do so safely. So a lot of our guidance will hinge upon where we are in November and December. But I do think that there are some common principles that everybody ought to be aware of. And so we're in the process of pulling all that together for the public now.
Thank you.
Question, thanks, Tanner. Our next question comes from Patty Singer from Minority Reporter.
Hi, curious as to what are the plans to continue the COVID-19 testing, flu shots and beyond this week in some of the city areas? What's the long-term plan for that?
Patty, that's something that we're going to reevaluate after we get through the last several weeks to find out how the testing has gone. Right now, I think it's gone incredibly well. There's been several hundred people at each one of the testing locations. Also available was flu shots to the community as well. So we'll reevaluate after the next few days at the next location that I announced earlier. And should we continue to see that need in the community, the opportunity could exist to continue that. One thing I would note is that that we've had several hundred folks that were tested right in the community where they live. And that, I think, is critically important, that we bring our services to where people are and the testing to where people are to break down those barriers and access to those services.
Do you have a follow-up, Patty?
Yes, I do. Now that we're going to go into flu season and we hear about, boarding in hallways and crowds in hospitals, at what point will the increase that we're seeing in hospitalizations in the region for COVID become a concern as we get into flu season?
So I'll take that question. So we are doing the projection modeling that we had been doing in March and April and May all over again. And we're factoring into that the seasonality of influenza, given that we don't actually know what influenza is going to look like this year. So I think the best assumption is it's going to look as bad as previous years. And certainly the hope is that it won't be as bad. You'll note that it's currently October 15th, and we currently have not yet really begun the flu season here in Monroe County. And in most years, we will have seen a number of cases of flu already at this point in the year. So, if what happened in the Southern Hemisphere holds true here, we're hopefully in for a lighter season. But I certainly don't want to take that for granted. I think the most important guidance I can offer is make sure you get your flu shot, because that is what we can control about the influenza numbers here in Monroe County. But as we look ahead, we'll be doing all the same mathematical modeling and trying to stay on top of the capacity, just as we did in the spring.
Thank you.
Thank you, Patty. Jennifer Lukey from WHEC, you're next.
Hi, Dr. Mendoza. I'm wondering what your thoughts are about the clusters that we're seeing in colleges in particular. Obviously, we have the Nazareth situation here in Monroe County. And just sort of containing that spread. Are the colleges doing the right things? And for those that are planning to have students sort of come back after Thanksgiving, do you have any concerns about that?
So a couple of schools of thought on these clusters. One is that they're just now getting caught. Because the schools are doing such a good job of screening, we're detecting them now. We don't know if they were happening in other parts of the community prior to all this, because we didn't have as rigorous testing in the community as colleges have on their campuses. So some of this may simply be a sampling bias that we're now detecting them because we're screening more often. And so, yes, I am concerned that as the winter months come on, particularly if people go home for Thanksgiving and come back, that certainly can increase the risk of infection here in Monroe County. I will say that I think many of the local colleges and universities are looking at being remote, if not entirely during December, a good part of that, to try to mitigate the risk of going home and coming back to the area. So those are questions that our colleagues at the higher ed institutions have been thinking about really since the summertime. But in general, as we look at the prospect of going back indoors, certainly that is something that we're paying very close attention to.
And a question that we continue to hear from parents of kids in elementary, middle, high school is, and I can't really wrap my head around this either. How is it possible that a child could be suspected COVID positive or confirmed COVID positive, and their sibling, who they're exposed to probably all night and during the weekends, can still go to school?
So that's a complicated question. So somebody who is confirmed positive, assuming that they live with all of their siblings, the entire household will be quarantined. If somebody is under quarantine, the rest of that household is unaffected in general, because we wait until the person who's under quarantine to become positive, if they ever become positive, before we act on quarantining the rest of the family. Now, the complication now has arisen with the new K through 12 toolkit, which allows for an individual to not get tested if they're sent home from school with symptoms. The presumption, though, is if they're sent home with symptoms, we have to presume them to be positive, even though we don't know that. The better part of caution would be to assume that they have COVID, which is what we don't want to do. We actually want them to see their doctor and get tested so we can know definitively. But if for whatever reason they're not able or not going to get tested, we have to do the safest thing for the community, which is to isolate them as though they were positive. We are working with the schools very closely on how to manage all of this, but that is the way we have to proceed from a safety standpoint. But certainly our priority would be to have everybody seen by the healthcare provider and get tested as appropriate, because we don't want people at home for 10 days if they don't need to be.
Okay, next up we have Alex Creighton from WXXI. Alex?
All right, good afternoon. Can you hear me?
Yes, we
Yep.
can.
Okay, just wondering right off the top, what was the source of that report about the county's infection rate?
That was from the New York Times.
Okay.
The New York Times.
Halloween coming up very shortly. Is it safe to go trick-or-treating?
Mike, do you want to handle that? Or Dr. Mendoza, I'm sorry, do you want me to?
Go ahead.
All right. Well, so I think that first of all, the Department of Health, and I can let Dr. Mendoza talk about some of the protocol or some of the suggestions that they put in place. But obviously, there's a lot of families, including my own, who are looking forward to trick-or-treating and Halloween. And I do believe there is a way that we can celebrate Halloween and do it in a safe, responsible manner. If we do that through making sure that all participants involved are wearing a mask, our trick-or-treaters, if we're staying 6 feet apart, we're staying within family units, and following the guidelines that the Department of Public Health has put out, I think that we could still have a fun but safe Halloween this year. But we do have to follow common sense, but also follow the Department of Health guidelines, which don't change just because it's Halloween. We still need to keep a 6-foot distance, be in crowds of less than 50 people. Stay within your family unit if you can, and wear a mask and sanitize often, and avoid that close physical contact. If you could follow those guidelines, I think we can have a very safe and happy Halloween here in Monroe County.
Thank you, County Executive. What I'll add to that is, in addition to the guidance that we released a couple of weeks ago, I want to call everybody's attention to all of the related activities. You know, when we think of Halloween, we think of trick-or-treating, but we also have to think about the gatherings that we might have before we go out for trick-or-treating or when we get back home after trick-or-treating. All of the other Halloween-related activities. You know, some people love to go to indoor haunted houses. That's probably not a great idea. With people being in the dark, you're not going to know who is within 6 feet of you, and everybody's generally, you know, talking loudly or screaming. Those are the kinds of activities I want to call people's attention to, in addition to the trick-or-treating. I think trick-or-treating, relatively speaking, is among the safest things that we can do, you know, given that it's outdoors, you know, for brief interactions with, you know, homes. And for those homes, and there will be some who don't wish to participate, you know, I ask the trick-or-treaters to honor that. You know, you'll notice if a house doesn't have their lights on, you know, you might want to go to the next house. Let's you know, be respectful of one another's choices. And there are valid reasons for people not to trick or treat. So, but I do think in general, we can participate very safely.
Okay, thanks. The lights will be off here, yeah.
Okay, I'm not sure if we have any reporters on from Spectrum, but if we do, this is your opportunity. Sounds like a no. So let's go to Brian Sharp from the Democrat and Chronicle.
Hello. I was just wondering if you could speak a little bit more to, we are seeing a rise. I know we've talked about Nazareth and you've mentioned some with college gatherings and such, but seeing an increase as well in those under 10. I think the numbers for like effectively 0 to 20 are up about to around 30% of the new cases, where they've generally hovered just under 10%. What are you attributing those to? Do we have more than one college outbreak, or are these siblings of college students? Or I was hoping you could paint a little more detail to that.
Sure. So the 0 to 10 group, those are generally school-aged kids that we're identifying through testing. These are individuals who are getting sent home with symptoms, and they're getting tested and evaluated by their healthcare provider, and we're finding out of these positives. None of them are seriously ill, thankfully. But I think what you're seeing is effectively the outcome of increased surveillance. The way the schools have approached this, the way the colleges have approached this, the way the nursing homes have approached their employees, you know, we're essentially doing greater surveillance in the community as a result of all this testing. And I think that shows when you look at the overall testing numbers going up. But the actual percentage of those tests that are positive is holding steady for now, thankfully. So I think we're detecting more of the cases that have frankly been around all along that we're now only becoming aware of because we're testing more. We are still doing a lot of tracing. With more cases means more contact tracing, and that gives us actually the opportunity to connect the dots. And so to date, we've had at most one case, one example of within school transmission. All of the other children, many of them were actually all virtual, entirely virtual students, and so they haven't been in their school proper. And so the vast majority, if not all, of the cases in that demographic were acquired through out of school person-to-person contact.
I had one follow-up, a bit off topic, but given the times that we are in with the isolation, I've been looking at some, and I know not too long ago we came out with a 2019 report on opioids and overdoses. Looking at the numbers for 2020, it looks like deaths are tracking ahead of last year, and that would be reversing a trend that's been down. I'm just wondering what you are seeing in that regard, if that is all related to the situation that we're in, or if you see something else happening there.
I think it's going to be hard to call the final score until the end of the year, because a lot of the data that we see throughout the year are preliminary. You know, we don't have final results on many of these cases until months later. Certainly, you know, we're going to wonder whether there's an improvement or not. We're certainly going to attribute something to COVID. I mean, COVID has changed how we interact in so many parts of our society and healthcare as a result. So, but I think it's probably too early to call the final score.
Thank you.
Thank you, Brian. And our final question comes from Kayla Green from WROC.
Good afternoon. So my question is regarding the vaccine. So obviously there's a lot of months and dates flying around of when people think it'll be approved. So based on what you know, what do you think is a fair estimate on the approval? And do you think Monroe County will be able to begin using it once it is approved immediately, I guess?
So there's so much about the vaccines that is yet unknown. But what I can share with you is that I do not see a vaccine coming to our area or really anywhere widely available in the United States before the end of this calendar year. And many experts say at least 6 months into next year. That could all change. I know that the industry is working very hard to find a viable vaccine. But what I will say is that I would not endorse a vaccine unless we know that it is safe and effective. And we will know that by looking at the trials, looking at the data behind the development of those vaccines. I think that is the only way that we can properly evaluate whether a vaccine is ready for prime time. And I will certainly be looking at that, and that is the only thing I will look at with regard to whether or not to recommend a vaccine to this community. But I would say for the short-term future, we need to proceed as though there will not be a vaccine for at least the next several months.
All right, thank you. And then another question in regards to the clusters. I know we've mentioned that we've seen them at colleges, but are there any other specific areas or activities that you've seen as far as where these clusters are coming from?
You know, it's in close-knit communities, in families. You know, families, large families, it shouldn't be a surprise when one person in a large family acquires COVID-19 that the rest of the household also follows suit. There hasn't been a consistent activity, if you will. You know, the activity is gathering. It's gathering in close spaces, as we've been saying all along. But there hasn't been a single type of activity. I can't point to restaurants, I can't point to bars or schools or any of the other things that have been open other than the community in general. It's those gatherings that we have in our backyards, in our homes, you know, in the community. That's what has been the greatest risk. Even on college campuses, it's not attributable to being at school. It's all of the activities, the social gatherings that happen out of school. So I just want to, you know, make sure we reiterate the importance of using our common sense and following the guidelines.
Okay, thank you. That does it for questions, and we'll end the meeting.
Julie, real quick before we leave, if I could add one more thought that I neglected to mention earlier in my remarks. So there is continued also broader testing that is free for COVID-19 available to our community that has been set up by New York State Department of Health, and it's located at MCC. in the parking lot there. And a lot of folks have probably seen some activity over there if you've been driving by with different tent structures going up. The state has made a commitment that testing location will be here, and they're making provisions to allow that site to continue to operate as the weather starts to turn. So I would encourage this community, if you are in need of a COVID-19 test, whether you are symptomatic or not, you can sign up. We have the links available on our website, monroecounty.gov, and www.monroecounty.gov. You can links right to the department, New York State Department of Health website, where you could sign up. You do have to have an appointment, but they take hundreds and hundreds of people every day. They have a very good capacity there, and it's a relatively, I think, convenient resource for the community to use as well. So that site's going to continue to operate here even as the weather turns, and I'd encourage the community to utilize that resource that the state has made available to us. Thank you all very much. Appreciate your time today and your questions. We look forward to seeing you again next week.